Good afternoon, friends. I'm Dr. Aajay Shah, and this is our second segment of Alzheimer disease, how to prevent and reverse it. This uh, segment follows the first segment I did yesterday. If you have not watched the first segment, please watch the first segment and then come down to the second segment. We are also on Facebook, Healthy Living with Dr. Ajay Shah. So go and like our page. We post every day, 4 or 5 times a day about the tips about healthy living, also about career, about happiness. So please like our page. We are also on Instagram. So let's start talking in this segment two on how to prevent and reverse Alzheimer disease. Uh, there is a myth in many doctors and many people that lifestyle cannot prevent Alzheimer disease. In my opinion, it's a myth. Actually, it's been proven now that 90% of cases for Alzheimer disease can be prevented by lifestyle changes. And we will talk about those lifestyle changes as we go. And the remaining 10% of cases, which typically happens because of genetics, the Alzheimer disease can be delayed by 10 to 15 years, and severity can be also slowed down. So again, definitely lifestyle has a major impact in terms of prevention of Alzheimer disease, halting the progress of Alzheimer disease, and also reversal of some of the mild cognitive impairment, which we'll talk about. So again, what is the healthy lifestyle? Healthy lifestyle, as I keep explaining over all my videos for last 2 years, a healthy lifestyle includes 6 pillars. What we eat, again, eating whole food, plant-based, no oil diet, and I have many videos on that, so please reach out to those YouTube videos. Regular physical activity, 7 to 8 hours of sleep, avoiding any substance abuse, having a good relationship, and having a stress management. So all those things are important part of healthy lifestyle, and not only they work together, but they exponentially help each other. So you need all 6 pillars of healthy lifestyle. When it comes down to Alzheimer, there are four mechanisms. First one is having a chronic inflammation. uh, First mechanism is a chronic inflammation. Chronic inflammation happens because of what we eat, typically processed food, sugary meals, white flour, white rice, animal products, and many toxins. Those lead to chronic inflammation. Also, lack of sleep also can lead to chronic inflammation. So one mechanism of developing Alzheimer disease is chronic inflammation. So we should prevent chronic inflammation as much as possible. You can check whether you have chronic inflammation or not by checking CRP level, C-reactive protein level. Second mechanism for Alzheimer disease is oxidation. Every day, because of the free radicals, oxidation happens in our body. And also certain kind of food creates more free radicals. Lack of sleep creates free radicals, and certain toxins creates free radicals. So again, these free radicals lead to oxidative changes in the neurons, in the connections in the neuron, and that can lead to Alzheimer disease. The third mechanism is glucose dysregulation or insulin resistance. Matter of fact, Alzheimer disease is also called type 3 diabetes, because neurons in the brain develop resistance to insulin, and glucose cannot get into those neurons because insulin action is hampered. Again, so glucose dysregulation plays a large role in development of Alzheimer disease. People who are diabetic, they have a multiple times risk of developing Alzheimer disease and dementia. And again, this glucose dysregulation or insulin resistance happens because of obesity, because of a high sugar diet, because of eating a lot of simple carb and eating a lot of high fat diet. This leads to not just obesity but insulin resistance, and that can lead to Alzheimer disease. So again, if a person has diabetes, that person is a very high risk of developing Alzheimer disease. So by all means, diabetes should be prevented, diabetes should be reversed, and obesity should be prevented, obesity should be reversed. There's also another mechanism: the people who are obese, people who are insulin resistant, people who are even pre-diabetic, they have high levels of insulin in their blood, and that insulin actually competes with the enzyme called insulin degrading enzyme, and this it's the same enzyme which actually clears the amyloid plaque in the from the brain. So again, when you have high insulin level, that enzyme gets busy removing insulin instead of removing amyloid plaque. And that's the reason a high insulin level in typically in type 2 diabetes, in pre-diabetes, also can lead to Alzheimer's disease. Again, that mechanism of insulin degrading enzyme, please look it up, read more about it, look it up on YouTube and look it up on Google also. And for that reason, nighttime eating also actually has been shown to cause more Alzheimer's disease. It's a nighttime when amyloid plaque gets clear because our synapses space in the synapses increases, and that's when the amyloid plaque gets clear at night. So if a person eats at night, this insulin spikes at night, and that leads to inefficient clearance of amyloid plaque, and that leads to more chance of Alzheimer's disease. And the last mechanism for developing Alzheimer's disease is a lipid dysregulation. Levels of LDL when it's high, levels of triglyceride when it's high, that can cause more Alzheimer's disease. Matter of fact, ApoE4 works through the lipid dysregulation. ApoE4 is the gene which has shown to cause much more Alzheimer's disease, and ApoE4 gene, which we'll talk about it, works through the lipid dysregulation. So again, people who have a high cholesterol are at risk of developing Alzheimer's disease. People who have high cholesterol are also at risk of developing vascular dementia. So there are other risk factors. Let's go through risk factors for developing Alzheimer's disease. Those are diabetes, poor diet with high sugar and high saturated fat, obesity, excessive alcohol, smoking, sedentary lifestyle, head trauma, small vessel disease, that means small arteries in the brain getting plaqued up, poor sleep, high blood pressure, chronic stress, and high cholesterol. Those are some of the risk factors for developing Alzheimer's disease. So what are the protective factors for preventing and reversing Alzheimer's disease? Those include exposure to sunlight, taking vitamin D supplement if necessary, taking omega-3, physical activity, meditation, stress management, relationship, continue learning and continuing involved into brain activity, having a purpose in life, 7 to 8 hours of sleep, whole food plant-based diet with no oil, and eating a complex carbohydrate with 70% carbohydrate, 15 to 20% fat, and 10% of protein. And like I said, having a high omega-3 in your diet. All those things are protective factors for preventing Alzheimer's disease and reversing Alzheimer's disease. So Alzheimer's disease essentially is a deposit of amyloid plaque in between the neurons into synapses. Also in Alzheimer's disease, tau protein also gets deposited into neurons, and both of them lead to eventually the symptoms of Alzheimer's disease. Many doctors think the Alzheimer's disease is a progressive, but truly with the lifestyle changes, it can be halted. It can be actually partially reversed also. And definitely Alzheimer's disease, like I said earlier, 90% can be prevented with the lifestyle changes. Our brain is very resilient. Brain has about 80 billion neurons and quadrillion connections, and we have a lot of overlapping blood supply, multiple dual blood supply, so brain can sustain a lot of the insults. It's when those insults are over happening, that's when the Alzheimer's disease starts happening. So again, just with a simple lifestyle changes, you have a very high chance of preventing Alzheimer's disease. And I've been keep talking about healthy lifestyle, all the 6 pillars. Please watch our other videos and see you can start the healthy lifestyle. Uh, Actually, I've seen many patients lately who are in their 60s because of poor lifestyle, including obesity, diabetes, high cholesterol. They actually develop Alzheimer's disease in their 60s and 70s, which is very concerning, very, very alarming. Let's talk about ApoE gene. ApoE gene is the one which has been shown that it causes Alzheimer's disease. If a person has no ApoE gene, then 50% chance of developing Alzheimer's disease after age 85. If the person has a one copy of ApoE gene, it's about 50% chance of developing Alzheimer's disease at age 75. And if a person has two ApoE gene copies, then person has a 50% chance of developing Alzheimer's disease at age 65. So again, if a person has an ApoE gene, one or two copy, they get Alzheimer's disease at a younger and younger age. If a person has a both copies of ApoE gene, then by age 65, there's a 1 in 2 chance that the person will develop Alzheimer's disease. Fortunately, only 2% of population has ApoE gene, so 98% of people are not going to have a two copies of ApoE gene. And again, even with ApoE gene, if lifestyle changes are made and if healthy lifestyle is lived, chances of Alzheimer is very low. And like I said, so 1 in 2. So if you have the healthy lifestyle, you will not be that one person who gets the Alzheimer disease. As we know, that epigenetics plays a large role, and we say that genes are like loaded gun, and our behavior or our lifestyle uh, triggers the gun. So again, if you have a healthy lifestyle, you will have a loaded gun. That means you will have genes, but you will never develop the Alzheimer disease. So again, even person who has ApoE gene, the Alzheimer disease, both copies of ApoE gene, Alzheimer disease can be delayed and can be slow down even once it happens. In general, women develop Alzheimer disease more often. 1 in 6 women will develop Alzheimer disease at age 65, while 1 in 11 men will develop Alzheimer disease after age 65. So women need to be very, very careful about Alzheimer disease. Aging in general plays a role only because there are accumulative years of unhealthy lifestyle. But a lot of people in a lot of blue zones like Okinawa, people live up to 100 and then don't develop Alzheimer disease. So many times I hear that Alzheimer disease is a disease of aging. That's not true. If a person lives healthy lifestyle all their life, even at 100, Alzheimer disease will not happen. We also know that this Alzheimer disease happens because of amyloid plaque deposit, and now we have enough data. This amyloid plaque deposit actually is a response to the unhealthy lifestyle. So removing amyloid plaque has not worked out. There are many drugs been tried to remove the amyloid plaque, but those drugs have failed miserably. So again, removing amyloid plaque is not the solution. It's preventing the amyloid plaque deposit, preventing the root cause, which is unhealthy lifestyle, which leads to the amyloid plaque. So again, removing amyloid plaque is not the answer. In terms of the drugs, between 2002 and 2012, 250 compounds were tried and only one drug was approved, Namenda. We will talk about drugs in our next talk. But again, this starts our good discussion about Alzheimer's disease. We will talk about the symptoms. We will talk about every aspect of lifestyle. This video we will continue in our next segment, segment 3. There are going to be about 30 segments on Alzheimer's disease. Watch one after other segment. Watch multiple times. Like I said, we are also on Facebook. So go ahead and like our page on Facebook. Invite your friends to like our page on Facebook. We post on Facebook every day, 3 to 4, sometimes 5 times about healthy tips, about healthy lifestyle. So go and like our page, invite your friends to like our page, subscribe to our channel, and definitely watch other videos on our YouTube. Thank you.